do you see a correlation between hair loss and lack of iron or calcium?
Definitely. We have a lot of issues that iron will be at stake and then calcium at stake. See, many a times it is either hormonal or it may be deficient state, which is are the post diseases. There will be hair loss. Sometimes it will be supporting by the family or the hereditary factors. Otherwise, most of the time it is by different type of situations where deficiency of iron, deficiency of calcium, and deficiency of folic acid, and these type of things will also end up in hair loss. Then there is a post disease like typhoid fever or malarial fever or something like that. Then afterwards they earn that they particularly 40 years around age factor. Then comes the hereditary support. These are the usually 4 or 5 varieties of patient we used to come across, and very rarely some rare occasions some very premature hair loss people will come. Otherwise, these are the main area where we have got a lot of people come with these type of things, and we try to convince them with the use of medication as well as applying oil, because many of the young generation doesn't want to apply oil to the hair, and if you don't apply oil to the hair, then the hair will not be present. If you want to keep your hairs, you apply oil. The very straight way I will convince them.
And doesn't Narasimha Rasayana increase weight? Can this be given in some people who are already obese and battling for weight loss? And any other hormonal tests like thyroid, etc., that you recommend?
Yes, of course. Many a times thyroid also plays a role that needs to be checked in. And of course, while taking history, we'll come to know about all these things. When we ask them, do you suffer from any conditions? Do you taking any medicines for any conditions for a long time? Or are you suffering from diabetes, hypertension, hypothyroidism? Now, it is a very common protocol. We'll ask each and every patient when they come. So when such information is available, then definitely we'll try to assess those hormonal levels also before they starting the treatment. And definitely those who are obese, we cannot give Narasimha Rasayana, because of course it helps in gaining the weight. But what I suggest is, when we are having this type of trouble, we are unable to give Narasimha Rasayana, then we have 1 or 2 companies producing the same Narasimha Rasayana in the form of Narasimha tablets. So where there is no butter and ghee portion of this, only the drugs are available in the form. But still we can't expect the result would be the equal. But something it's a better alternative for that.